Dr. Xianlin Jin is an assistant professor in the Department of Communication and Media at the University of Toledo. Dr. Jin integrates quantitative, big data, and qualitative methods to study social mediated crisis communication, health communication, and human machine communication. Dr. Jin's latest publication is titled What and Where Do I Learn About the Baby Formula Shortage Crisis? Exploring Crisis Communication Patterns, Influencers, and Information Resources. Dr. Patric Spence and Dr. Kenneth Lachlan are the co authors of this publication. This paper is now available to access in the first issue of Volume 76 of the Communication Studies Journal.
We spoke with Dr. Xianlin Jin about this research paper. Here's a brief abstract. The baby formula shortage escalated into a national public health crisis, spurring public discussion on social media. For the study, more than 20,000 X posts were examined, and 20 X influencers who control the information flow were recognized. Crisis communication patterns were unpacked by analyzing the content of popular links shared in the network and generated by the top influencers. To learn more, keep watching.
Oh, if someone remember, back in 2022, there was a national level baby formula products shortage. And this crisis is very unique because there are so many factors make this crisis worse. For example, at first there was a massive baby formula products recall. And then because of the supply chain issue has been impacting our life for such a long time and has not been resolved since the pandemic. Yeah, so which make things even worse. And there are also policy level restrictions regarding US cannot import alternative products from other countries to fill the shortage very fast. And there are also issues related to market concentration. So it's very complicated. It also impacts millions of families in the US, especially low-income families, because the products have been massively recalled. Are also the products are in the federal program that offer baby formula products for low-income families. So those families, unfortunately, were hardest hit and hardest impacted by this national public health crisis. Yes, so at first, when we collect data about this national shortage crisis, we were thinking, considering this is a baby formula products shortage, we thought mothers, families, like nutrition, they maybe the influencers, or at least their voice will be heard on social media. But surprisingly, that is not the case. So at first, we propose several research questions, particularly who are the top influencers within this baby formula information network from Twitter, right now is X. And what are the top links shared in the baby formula information network? And what links, if any, do top influencers share in the baby formula information network? So when we care about this, based on what we learned from previous crisis literature, there are, first of all, inconsistent ways to conceptualize and also optionalize influence. Some studies suggest, okay, if this account has a lot of followers, then that account must be influential. But this way to study influence lacks consistency in conceptualization. So we revisit the opinion leader argument, particularly focusing on the bridge influence, which reflects one user's ability to randomly connect any other users in a network with the shortest path. So that actually is social network analysis approach, right? Identifying the position of a user in the network. And in this case, it's the information connected network about baby formula crisis. And then we care about, okay, what information those influencers have shared with other users in this network, and what are the dominant things emerged in the entire network. Are there any similarities regarding, the information circulated in the network and the information shared by those influencers? So we want to make a comparison to see whether, those influencers can really shape people's opinions and attitudes about this crisis. That's why we propose those two other research questions, and we further developed the content analysis by analyzing the top links and their content in the entire network, and also shared by those top influencers. So basically, the first step is to identify who are influencers, who control the information flow, and second, what information they share with other audience. Third, are there any, overlapped or unique things emerged in the entire network and also shared by those top influencers. So first, without women should be heard regarding this crisis. And when we look at the list of the top 20 influencers that we identified in this article, we were surprised that women were not often heard. That is a surprise for us. And many of those top influencers are accounts associated with political backgrounds. Some are politicians, some are political, propaganda accounts. And many influencers are also media outlets, people who have professional media backgrounds. Only one account self-described as a mother on social media, one account self-identified as a nutrition therapist. So that is something surprised us. And also, another aha moment we realize is actually when we look at the content shared by the entire network and also by those key influencers, there are many overlaps. So people care about, the public health crisis of this national shortage, the impacts and the consequence. And also there are one of the popular links circulated in the entire network. That is also the link shared by top influencer. So that article particularly says that breastfeeding should not be the resolution of this public health crisis, because there are some people's first response was like, oh, you don't have baby formula products, you can breastfeed your kids. That should not be hard. And that article particularly lay out all those different reasons why breastfeeding should not be the resolution. First of all, some families, for many reasons, they cannot choose breastfeeding. And there are a lot of studies show that actually if the mother has to breastfeed children, And that will not only impact their mental health issues, but also impact their workability, their income, which especially make low-income families situation even worse. So there are a lot of issues associated with breastfeeding. And most important thing is this is a national level shortage. This is a public health crisis. And people have the right to decide whether they choose breastfeeding or not, considering their unique situation. Breastfeeding is personal choice, and that's not the resolution to a massive national level crisis. So this logic behind, okay, breastfeeding can solve the problem, basically shift the responsibility from relevant government agencies, those companies to those individual family who actually does not have much power during this crisis. First of all, like when we look at all the content shared by the top influencers and also circulating in the network, we find that the most shared content actually stems from media outlets and media professionals. So that indicates, as professional media outlets, they have the responsibility to actually share accurate information with the public in a timely manner. And also from a practical perspective, when crisis occurs, our findings suggest that social media should be used to monitor the real-time conversation about this crisis. And we can use social media as a platform to understand the public concerns. But it also revealed that general citizens' voice, especially those families who have been impacted by this national shortage, have not been heard well on social media. Even we assume that social media is a place that everyone can share their opinions. But the problem is that those voices have different weighted credits, even on the internet. So I think in the future, that is something I'm actually working on as well. In the future, it is really important to compare the health and crisis communication pattern that happened online and offline within the community, which has been impacted by the crisis. In this case, we can understand those real concerns and also help those community voice their opinions, their needs, their concerns, and help them to build resilience and get family support. Yeah, so as I briefly mentioned before, when we study especially crisis communication patterns, we have some challenges. First of all, when people face chaotic and crisis, they often feel really anxious, really scared, and and as a result, we cannot really interview people when they are suffering crisis. And we also have some limitations regarding data collection. If we collect self-reported survey response after crisis, people may not perfectly or accurately recall what they have done during crisis. So our approach is to analyze real-time data that people post on social media about a specific crisis. That is our approach. And I think this approach can help us at least understand some real-time crisis communication patterns. And another thing is we always propose the importance of integrating different methodologies while studying crisis communication patterns. In this article, we particularly integrate social network analysis and content analysis to help understand the information resource, key information, influencers, and also crisis communication patterns emerged on the social media platform. One thing is about the advantage of working collaboratively with different scholars is that actually it helps us to approach or at least view the question differently, and how we approach with different theoretical perspectives, and that will help us brainstorm and also be open-minded while we study complicated crisis communication patterns. And I think that matters. And for compared to your individual work is something that you, of course, you have passion for, and you have been using this approach for a while. And with some other people join the conversation, they can offer some different new perspectives that you may not think about before. And now, after brainstorming, let's work on that and see how it develops. Yeah.